Good evening. I'm Daniel Benjamin. I'm the president of the Academy, and I'm delighted to welcome you to tonight's lecture entitled A Brief History of Public Health and Immunization in America, which will be delivered by Ann Schuchat, this semester's Bayer Fellow in Health and Biotech. And before I introduce our speaker, let me just say a quick word about the fellowship. The Bayer Fellowship in Health and Biotech was inaugurated in 2021 with very generous support by Bayer AG. The fellowship, we believe, contributes materially to the transatlantic exchange on innovation in the field of health and biotech by supporting interdisciplinary dialogue with representatives from the academic, corporate, political, and public sectors. And on an even more parochial note, I would just say it has enriched the life of the Academy immeasurably. It has just been wonderful to have one fantastic Bayer Fellow here after another, beginning with Howard Koh, Harvey Feinberg, Bert Hoffman, last year Rochelle Walensky, really outstanding people. And in a world where we all talk about interdisciplinarity, but there's seldom a public health person across the desk or the table from a historian or an artist, this has really been fantastic. So I really want to thank Bayer and especially the Academy's good friend, Oliver Renner, for generously supporting this fellowship, for making tonight possible, and for being a really strong supporter of the Academy for over 20 years now. I think Oliver's even greater loyalties lie to the yacht club outside, where he's the charter member. But we're glad that he stops here on the way there, and so thank you very much, Oliver. Really a great friend of the Academy. I also want to give a warm welcome to many distinguished guests from the German medical world. I think if you're going to have a fainting spell at the Academy, tonight's the night. Among them is Vice President of the Robert Koch Institute, Johanna Hannefeld. We found out we have lots of connections, and I know a lot about her family. We won't go into how that happened, but if you happen to be in Northwest DC, you can drop by and see her brother, the ambassador of the Federal Republic of Germany to the U.S. Thank you very much, Professor Hannefeld, for hosting Ann at RKI last week for an in-depth exchange on transatlantic challenges in public health, no shortage of those, and current topics in immunization in Germany. It's also my pleasure to welcome the Vice President of the Brandenburg State Parliament, the Landtag, Julien Grun, to the Academy. We're very pleased to have you. Where is she? She was across the table from me. Oh, she's all the way in the back. Thank you. We love it when legislators come. As I said, we've had this amazing lineup, former Assistant Secretary of Health, former head of CDC, former provost of Harvard, and on and on. And this is just a great fellowship. So now to our fellow. Ann's looking really suspicious, like I'm going to do something untoward here. Ann Schuchat is an internist and an epidemiologist with 33 years of service at the Centers for Disease Control and Prevention. You know how to hold a job, I guess. I've never done anything for more than 7 years. When she began her career as an epidemic intelligence service officer in 1988 after receiving her medical degree from, of all places, the Dartmouth School of Medicine, now known as the Geisel School of Medicine, and she completed her residency at NYU. Ann led the respiratory diseases branch and was the founding director of the National Center for Immunization and Respiratory Diseases from 2006 to 2015, where she oversaw U.S. immunization policy implementation and contributed to the introduction and global deployment of vaccines against pneumococcal and meningococcal disease. I say that right? Thank you. She served as principal deputy director of CDC from 2015 to 2021, and during that period was twice acting director because our democracy doesn't really work fast in getting new nominees into the job. And she had a responsibility for agency-wide scientific and emergency response activities. She has focused on infectious disease epidemiology and outbreak response, including leadership roles during the COVID-19 pandemic, the 2019 outbreak of vaping-associated lung injury. I don't know why people do that. The 2009 H1N1 influenza pandemic, and the 2003 SARS outbreak. She's contributed to vaccine trials for meningitis, pneumonia, and Ebola in West Africa, and to surveillance and prevention programs in South Africa. In the 1990s, she led the development of guidelines for prevention of perinatal group B streptococcal disease. This is one of the toughest introductions I've had. Associated with an estimated 100,000 prevented cases of severe neonatal infection. Anne is a member of the National Academy of Medicine and recipient of many federal and professional honors, including the U.S. Public Health Service Distinguished Service Medal and the Lifetime Achievement Medal from the Association of State and Territorial Health Officers. So every semester or two, we have one person who, like, you could be talking about their achievements till the end of their lecture, and Anne is that person. If you look up her Wikipedia page, it has all her medals from her time in the Public Health Service. She is an admiral. She didn't wear a uniform tonight, but she's a real honest-to-God admiral in the Public Health Service. And she has so many medals. I mean, the commander of Desert Storm didn't have as many medals. She also, and this is everyone's favorite fact about Anne, is that she was played by Kate Winslet in Contagion. Was that the movie? Right. And so I've spent a lot of time thinking about that. And I thought, when that happens, do you go home and you say, wow, that's it. I've been played by Kate Winslet. Everything else is gravy. Or do you go home and say, next time I'd like it to be Anne Hathaway or Margot Robbie or something. I mean, I need a better agent or something. You're not going to address that question in your remarks, are you? Okay. I'm not going to embarrass you anymore. Currently, Anne serves on the board of Gavi, the Vaccine Alliance, which does unbelievable work, and she is working, including here at the Academy, on a book analyzing CDC responses to major public health events with particular attention to vaccine impact and challenges related to misinformation and public trust. Just a roadmap, and we'll talk about 35 minutes. No one has hit their mark yet this semester, so take that with some caution. And then she will answer questions. If you're here at the Academy, please raise your hand, wait for the microphone, make sure your question is a question. If you are joining us via Vimeo, please type your question in the Q&A part of the platform, and hope that your speaker can look at the platform as well. And again, the Academy's mission is to foster open, thoughtful exchange and to serve as a place for serious dialogue. So we thank you in advance for engaging in that spirit and for respecting varied perspectives. Anne, it is so great to have you here. The floor is yours.
It is so exciting to finally be doing this, I have to say. I would like to thank the Academy, the staff, the donors and trustees and supporters, and the community who shows up for these events and makes them so special. I also want to thank the fellows and their families who've made my time here really extraordinary and have become like family. And so I wanted to start with a family story. My grandparents were at the movie theater when they were summoned to the lobby. There was an emergency at home. At the hospital, they found out the diagnosis. My uncle had encephalitis, which is inflammation or swelling of the brain and can lead to permanent damage. The cause, measles. Their house was placed under quarantine orders. My mother was kept home from school until it was clear that the danger that she might spread the virus to her classmates had passed. Fortunately, my uncle recovered, but my mother learned then that measles can be serious. Many years later, I had the measles and was really sick with very high fevers, spiking temperatures off the wall. It was really, really kind of scary for my mom. She stopped taking my temperature because she said she was worried the mercury thermometer might burst. My illness was one of about 500,000 that affected Americans that year. But within a couple years after that, anybody who wanted to could be vaccinated against measles. And that virus began its journey into the history books. The past year in the United States, history seems to be going in reverse. And that's the long, winding story that I'm going to share tonight. The tensions between fear of infectious diseases and the tools that we have to prevent them have deep roots in the United States that actually predate the nation itself. The story begins with smallpox, which killed an estimated 300 million people worldwide in the 20th century alone. One of our founding fathers, Benjamin Franklin, refused the offer to have his son inoculated with the precursor of the smallpox vaccine, worrying about its potential complications. But then his son died of smallpox, leading him to urge other parents to not make the same mistake he had. The regret may be the same either way, therefore the safer should be chosen. George Washington survived his smallpox infection, but he was very weak during an extended period of his recovery. So when the Revolutionary War was happening, he initially prohibited the troops from being inoculated against smallpox. He was worried about that recovery period, which could follow the inoculation as well, and didn't want the British to take advantage of the vulnerability of the troops. But so many troops were dying of smallpox, it turned out it was deterring enlistments. And so he was presented with that new evidence and he reversed his decision. He lifted the prohibition and he ordered mandatory immunization of troops against smallpox. To avoid detection by the British, he ordered that this mandatory immunization campaign be done in secret. Some historians credit protecting the troops from smallpox as being pivotal in the Revolutionary War's outcome. So we have an American leader who is presented with new evidence and updates his assumptions and makes a new plan. And he issues a mandatory immunization order and has it done in secret. This somehow did not spawn endless conspiracy theories, but is credited for winning the war. We've come a long way. I think the most remarkable chapter of immunization in America was the largest ever vaccine clinical trial. 15,000 public schools in 44 states participated in this trial. About 600,000 children who were in first, second, or third grade, and if any of you are in the audience, please let me know. I have met several people who were in this trial, but 600,000 children received 3 injections with either the inactivated polio vaccine that was still experimental or placebo. The results of the trial were announced in an auditorium in Ann Arbor, Michigan, and live over radio and the new medium television. The nation celebrated, the vaccine worked, and polio headed towards elimination. The success against the polio vaccine ushered in a golden era in vaccine development in the United States. Scientists in universities, in government, and in the pharmaceutical industry focused on developing vaccines against the major causes of childhood disease at the time. During the one decade of the 60s, we got vaccines against measles, mumps, and rubella. I'm going to talk more about measles in a few minutes, but I wanted to say a little bit about rubella, another illness of fever and rash that affects young children. The disease was first recognized by German physicians in 1814, and in the United States, we call it the German measles. Apparently, that's not what you call it. Rubella is fairly mild in children, but it can be very serious in pregnancy. 1964 to 65, there was a nationwide epidemic of rubella in the United States. Tragically, 11,000 pregnancies ended in stillbirth or miscarriage caused by the virus, and about 20,000 babies were born with congenital rubella syndrome, which includes deafness, blindness, and heart defects. A vaccine against rubella was approved in 1969 when the memory of the epidemic was still very fresh. And the vaccines worked. This is what happened to measles after it was introduced. The next decade, I'm going to do decade by decade, sorry. During the Cold War, one of the only areas of cooperation between the Soviet Union and the United States was the global eradication of smallpox. The last naturally acquired case of smallpox occurred in 1977, and by 1979, the world was declared smallpox-free. During the next decade, researchers focused on a new kind of vaccine called conjugate vaccines targeted against bacterial infections. Haemophilus influenza B, or Hib, was the leading cause of bacterial meningitis in the United States in children, affecting about 20,000 kids each year. But the conjugate vaccines were extremely effective, and within a few years of introduction, disease had fallen by 80%, and it is nearing elimination today. But while one childhood disease was getting much better, another was getting worse. And the end of the 80s saw a major resurgence of measles in the United States. 55,000 reported cases of measles and 123 deaths were reported. Many of the cases occurred in children who were poor and uninsured and had not been vaccinated because of that. The outbreak had a silver lining. Political will led to a new entitlement program. The Vaccines for Children program was implemented in 1994 and provides vaccines at no cost in the doctor's office to children who are uninsured and other vulnerable children. Expanded access through the Vaccines for Children program and a second dose recommendation led to elimination of measles in the United States in 2000 until now. So many children dying from measles 25 years after the vaccine was first introduced suggested how fragile the immunization ecosystem is. Supply and demand, access and delivery were closely interrelated. But the Vaccines for Children program served as an effective advanced market commitment to industry. If they could make a vaccine that worked against a serious disease and met all the criteria, a market would follow. Industry invested in research and manufacturing, and several new vaccines were introduced or were developed in the years that followed. They were welcomed by pediatricians and rapidly taken up by families. And the vaccines prevented disease, outbreaks, even cancer. These are a few of the newer vaccines that came in the years that followed and some of the impact that they had. Some of the staff at CDC put together a model of the impact that immunizing children in the United States since the Vaccines for Children program has had. The Vaccines for Children program era led to higher immunization coverage in uninsured children, but it also led to higher coverage in insured children, a stronger infrastructure, a stronger system. And we estimate over 30 million hospitalizations prevented and over 1 million deaths prevented in this era. So by 2024, we had vaccines targeting more diseases than ever. We had insurers covering vaccines that were recommended by the CDC's Advisory Committee on Immunization Practices, which used a transparent, evidence-based, deliberative, open process before a vaccine was added to the childhood or other schedule. We had achieved high percentages of children and teens who were immunized, and there were extraordinary research and development achievements with unprecedented speed and scale in developing new kinds of vaccines against COVID-19, and finally achieving a long-term target of a safe and effective vaccine against malaria and against RSV, a very common and potentially severe respiratory illness of young children and the elderly. With all of this progress, the future was not actually bright. The subtitle of my talk mentions success and misunderstanding. And here at the Academy, I've been thinking a lot about the nature of our collective misunderstanding. We're now at a tenuous and dangerous moment for immunization in America. How did this happen? Within the public health community, we were mistaken about the severity of the threat of the anti-vaccine movement. Only a very small percentage of people hold what I would consider extreme anti-vaccine views. We didn't take them on directly, not wanting to give their misleading arguments more publicity. Instead, we focused on the larger group of parents who may have had questions about vaccines, but didn't have deep mistrust of vaccines or the medical establishment. Since doctors and nurses were the most trusted source of information on vaccines, we wanted to focus on them, encourage them to use empathy and listening, and customize their conversations to the particular concerns that each parent voiced. This made a lot of sense in earlier times. But we had misconstrued how much power a relatively small group of influencers could have in altering the dynamic. We misgauged. I thought about wrapping this part, but I really couldn't figure out how to do it. We misread the moment in 2015 when an outbreak of measles began in Disneyland. We thought that outbreak signaled a turn for the better. The silent majority of parents who support vaccines seemed to find their voice and advocated for laws to make it harder for parents to exempt their children from school vaccine requirements. In that moment, you could say that we missed the boat completely. Behind the scenes on social media and in state anti-vaccine chapters, a merger of multiple groups was occurring. And farthest from our minds at the time was the possibility that one of the very leaders of unfounded attacks on vaccines would become the most powerful figure in health in the United States government. In January 2015, the California Health Department had identified the first case of measles in a person who'd visited Disneyland in late December. Soon, cases popped up across California and in 7 total states, in Canada and Mexico, mostly in people who were unvaccinated, either due to personal belief exemptions from required vaccination or in babies who were too young to be vaccinated, so-called innocent bystanders. Then came more vocal support for vaccination and anger at parents whose choices were harming other families. Multiple states passed laws eliminating all but medical exemptions. The media and public health personnel called it a turning point. Today we realize it was a turning point, but not the one that we had thought. According to the Texas immunization advocate Reksha Lakshmanan, the legislature bills kicked the hornet's nest of the anti-vaccine organizations. California's stricter rule on exemptions had its intended effect. There have been marked reductions in exemptions among kindergartners in California. But that wasn't its only effect. Anti-vaccine groups were organizing across the country. Renee DiResta has analyzed Twitter traffic related to California's vaccine exemption bill when it was under consideration in 2015. And she found that multiple conversations were starting to mingle. The dots here represent groups like the anti-vaccine community, the autism community, medical freedom advocates, and the conservative or Tea Party groups. And they started to merge together in a conversation around the California bill. You may be able to see a very faint little set of green bubbles over here. Those are tweets from the public health community, which was kind of whispering among ourselves. Long-standing anti-vaccine believers had found new partners. Unlikely bedfellows of this new coalition included people who mistakenly held on to the belief that vaccines cause autism, together with nature-loving, left-leaning environmentalists concerned about so-called poisons in vaccines, and the right-wing Tea Party and libertarian conservatives who just wanted less government. The merger of groups brought money, political influence, and broader audiences, strengthening each of the original group's potential reach, and setting the stage for the blow-up that would follow. The COVID pandemic is a much bigger topic than I can do justice to this evening. We traditionally think of pandemics in terms of disease and death. Economic disruption and the social aftermath of that were also major issues in the COVID years. Backlash varied around the world and within our country, but in the US, we did see substantial demonization of public health and scientific institutions and disinformation at a scale like never before. Anti-vaccine messaging after the Disney outbreak had evolved from misinformation about vaccine safety to reframe the issues as about freedom of choice. Parents should be making decisions about their children, not the government. Then the COVID pandemic brought public health and immunization into everyone's daily life. By August of 2021, amid the pandemic restrictions and vaccination scaling up in the United States, Tara Haley in the New York Times wrote, "This is the moment the anti-vaccine movement has been waiting for." And what followed was a linkage of vaccine attitudes with political party identity and denial of the seriousness of the pandemic. COVID was deadly. In the United States, over 1.1 million Americans died of COVID during the pandemic years. These data show the weekly toll of COVID deaths in the US during sequential waves of COVID viral variants. During the first 3 peaks, we had only non-pharmaceutical interventions at our disposal. Social distancing and masks aimed to slow the spread and protect the healthcare system while we had time to produce countermeasures. But in the United States, the vaccination rollout took off in early 2021. In March of 2021, when vaccination was surging in the US, the Center for Countering Digital Hate issued a report detailing what they called the Disinformation Dozen. These were 12 individuals who were responsible for 65% of the anti-vaccine content shared on Facebook or Twitter in a 6-week period in early 2021. One of those 12 people is now the U.S. Secretary of Health and Human Services. By the summer of 2021, I retired. Yay! I didn't know when I decided to retire, but the summer of 2021 was also the beginning of the Delta wave. The U.S. was lucky to have an ample supply of COVID vaccines and was developing recommendations for booster shots. But by that point, there was already substantial backlash against vaccines and a linkage of vaccination behavior with political party affiliation. Over the course of 2021, more and more Americans got vaccinated, but those who remained unvaccinated were increasingly likely to be Republican. Counties with more Republican voters had lower vaccination coverage. And in a fairly depressing slide, modelers have shown that the counties with the highest proportion of Republican voters in the 2020 election were those that had the highest death rates after the vaccine arrived. I think it's important to mention what didn't happen. The US had an outsized loss of life in the pandemic, but vaccination saved lives. We estimate, or a model from the Commonwealth Fund has estimated that COVID vaccination in the United States prevented about 18 million additional hospitalizations and over 3 million additional deaths, with a saving of over $1 trillion. I think that it will take years and perhaps decades to fully understand the impact of the COVID pandemic in each country, let alone in the whole world. But I think there's some things we learned very, very clearly. We learned that people can adopt new behaviors really quickly, whether it's social distancing or getting used to wearing masks or learning how to use Zoom. But people need support, and they need messaging that forecasts that things are going to change and that there'll be updates when things change. We learned that we can actually develop and produce vaccines in time to save lives during a pandemic. This was actually a first. But it takes a lot of money, focus, and manufacturing at risk, not the usual sequence of events in research and development. And it also, whether it'll be fast enough to save lives, will depend on the duration of the threat. We learned that risk perception affects acceptance of guidance, and risk varies by age, by medical condition, over time, by viral variant, but risk perception also varies and can be manipulated, including the perceived risk of the virus versus the risk of the interventions. And we learned what we always relearn, which is that trust flows through everything. Public trust in the US federal government dropped well before the pandemic, with major declines dating back to the Vietnam War and Watergate. But among federal government agencies, the CDC used to be at the top of trusted entities together with NASA. Some of the ways that we had built and maintained trust are less effective today. We had used these principles in practicing risk communication during previous public health crises. We wanted to be first, but we wanted to be right, and we wanted to be credible. Even in the cable news era, it was difficult to achieve all these goals. Critical to our success was to be open, honest, avoid absolutes, and express empathy. The current communication environment makes it impossible to be first. No one is first. We live in a world where no one is first, and there are simultaneous messages and narratives often circulating in isolated spheres or echo chambers. DiResta describes this new world as one of influencers who are sometimes accidental in gaining massive reach, algorithms which reinforce extreme views, and the crowd itself plays a very important role. She says that propaganda isn't new to our era, and the rumor mill has always allowed acquaintances to spread misinformation to the people they know. But she says that the propaganda machine and the rumor mill used to be very separate and distinct, and now they have collided. The technology behind the algorithms plays a key role in what gets disseminated widely, favoring the more emotional and outrageous, and financial incentives encourage even accidental influencers to extreme or inflammatory messages. Enter 2025. We had more measles cases last year than in any year since 1992. Last year around this time, some of you may have been here, Rochelle Walensky was giving her Academy Fellowship talk. All eyes were on Texas, where a very large outbreak was occurring. 3 people died, including 2 unvaccinated school-aged children. I want to say hi to Rochelle, who's watching online. That's a brief pause, sorry. And just show you what's happened so far in 2026. Outbreaks in 2026 are on track to exceed what we experienced in 2025. The outbreak in South Carolina was just declared over. It was actually larger than the Texas outbreak. There have also been outbreaks in Florida, and there's an ongoing outbreak in Utah. Most of the cases are in unvaccinated, including in schools and colleges with low vaccination levels. Another way to look at what's happening in 2026 is on this graph from Johns Hopkins, which shows you that we are way ahead of schedule in 2026 compared to the earlier years. Maybe we'll get lucky and it won't be as bad overall, but it doesn't look that way yet. Under the leadership of the current Secretary of Health, the infrastructure of immunization in the United States is being dismantled. Advisory committee members were fired, replaced by individuals with dubious credentials. Evidence reviews and policy deliberation protocols were ignored. The department canceled hundreds of millions of dollars in vaccine research investments, fired leaders and staff at agencies overseeing vaccine work, and withdrew from global initiatives. Public health is used to setbacks. Never exactly like the current one, but people have been very active taking steps to mitigate the harm from the kind of actions that I was just describing. A new entity has formed called the Vaccine Integrity Project, which is sponsoring evidence reviews of vaccine safety and effectiveness, similar to the type that the CDC staff used to produce. Healthcare professional organizations, the pediatricians, the OBGYNs, the infectious disease docs, and family physicians have been issuing their own vaccine guidelines based on that evidence. And groups of states in the United States are organizing, the Western State Consortium, the Northeastern States Consortium, and using the healthcare professional organizations' recommendations to issue policies, liaising with the insurers and so forth. There's a lot of other things going on. Since the Secretary released a new childhood schedule, which reduced the number of recommended vaccines from 18 to 11, a majority of states have actually rejected the changes, and a judge recently threw out the department's policies. That might sound like it takes care of the matter, but the situation has left parents confused, increased the burden on pediatricians, and may raise doubts that can circulate for years. And there is very much that the federal government used to do that can't be picked up by others. I don't want to minimize the risks of this moment, and I don't want to minimize the effects on the rest of the world. There you go. Some of you have seen the movie Contagion, which came out in 2011, and at the time people thought was an over-the-top disaster film. In 2020, it had a second wave of interest, and people thought it was a documentary. We can talk about Kate Winslet in the question and answer period. Potentially more dangerous than viral contagion is the threat of disinformation and misinformation. Today's information environment is really challenging. There are a few techniques that have some evidence for benefit. Fact-checking has been tried and has some benefit, but labeling posts as untruthful has been politically fraught in the United States. A technological approach introduces so-called friction, which slows a person from unthinkingly reposting or forwarding viral messages. Researchers are calling for strengthening data transparency, making the technology companies share how their algorithms work, what they're doing with your data to target you, and exposing financial or other conflicts of interest behind the various content. Pre-bunking is an approach that can help people become more savvy about fallacies before they encounter specific misinformation, and it may be more effective than trying to debunk misinformation after you've already seen it. At a practical level, there are steps we can take. To start, we need to understand the local context. Concerns and values can vary across geographies and within specific groups of people. We need to find trusted messengers, ideally from within communities, who can help. We can try to meet people where they are and work from there to build, maintain, or rebuild trust. In the US and in many countries, there are still structural barriers to vaccination that are unrelated to hesitancy or vaccine safety, and advocacy around access or regulatory gaps or insurance coverage may be useful. The last few months have shown us the value that comes from working together across states and regions. Some days it seems like the collective voice of concerns about the dismantling of the immunization infrastructure and vaccine policies has begun to influence the current administration. At least they've been walking away from earlier anti-vaccine messaging in the run-up to the November midterm elections. Besides individuals and organizations speaking up, we also need to support each other. In this room, with a number of public health leaders and medical staff, I just want to say that public health workers around the world have endured personal threats and attacks and are still exhausted from overwork and scapegoating during the pandemic. So it's a time for solidarity and supporting each other. In a kinder and more gentle time for public health, back in 2009, I was a spokesperson for CDC during the swine flu or H1N1 influenza pandemic. Instead of hate mail or death threats, I received this surprise gift in the mail. If I had not been at Lynn Cook's talk last week, I would call this outsider art. A retired gentleman, Mr. Harold Fukui, likes to make dioramas related to current events. And he sent me this flying pig, which is perched atop a syringe that is labeled H1N1 vaccine. The work was titled Swine Flu, FLEW. It works in English. I don't know what it does in your language, but the expression "when pigs fly" refers to something that would never happen. In public health, we have to be ready to deal with events that would never happen, the unimaginable but potentially catastrophic. Increasing vaccine hesitancy and discrediting public health and scientific institutions weaken a nation's preparedness to deal with future pandemics. And unfortunately, the next pandemic is coming. We may not know when or where it will start, but there are certain to be more pandemics. Learning from our mistakes and misunderstanding and building off our tremendous progress will be our best protection. Now, I didn't know Dan was going to mention the uniform, but our uniforms are a lot nicer these days, and our troops are much more inclusive. But I just want to end by thanking the public health workers of the past, the present, and in particular the future, because the next generation will be so critical in our global protection. And I want to end by thanking all of you for being here and for being interested in this topic, and particularly thank those of you online who are joining us at I have no idea what time. Thanks, everybody. Okay. So this is a self-moderated question and answer period for those who are used to the different formats. So I'm, love to hear your thoughts, questions, comments. And I think there are microphones if people want to say anything, or we want to vocalize. Mm-hmm.
That was wonderful, and really enjoyed that. One thing that I have been wondering about is what would we do differently about protecting teachers in schools so that kids could get back to school better? That's always really confused me, because you can't just shove kids back in schools and kill all their teachers. So I'm just wondering what the thinking is about that these days.
Yeah, there's so much that was going on in every country and community behind the scenes that may not have been so obvious. But and I think the issue of the individual versus the group and the immediate effects versus the long-term effects are really complex. And certainly few of us expected schools to be closed as long as they were in some areas. The CDC, in the US, it was March 2020 when things kind of shut down. And by April 1st, we'd gotten instructed to develop guidance for reopening of every kind of sector, schools, religious establishments, businesses, the travel and so forth. And the guidance that CDC staff developed basically had schools should be the last thing to close and the first thing to reopen. In a perfect world, there's data about what's happening in your community, and you dial up and dial down the interventions based on the local epidemiology. The US wasn't in a good position to have granular local data about circulation. And unfortunately, at a state level or a national level, things were very variable. So ideally, you wouldn't be, you would have kids in school as much as possible. There's particular ways that it can be safer, spaced out, better ventilation, masks where possible that it's not interfering with the education. But what we saw was a big range of decision making in terms of what to do, and a lot of tension in terms of families. So it wasn't just the teachers or administrative staff that were at risk, there were also vulnerable children. So, I don't think there was a right way to go, but obviously it was a really difficult time for families all over the world. Okay, over here. Mm-hmm.
I just wonder, do you happen to know how many people actually ingested bleach to battle the coronavirus?
Thank you for that question. One of the behind the scenes stories, I don't, but there are poison control centers that support emergency departments around the country. And it's a recurring theme, but one of the articles in the CDC's the Morbidity and Mortality Weekly Report, one of the reports that was kind of put together fairly quickly was this spike in calls to the poison control centers. But that was one of the reports that was delayed and wasn't allowed to be published until quite a lot later. So that's kind of happening again right now. But I think Sabrina and then Oliver.
Thanks so much, Anne. I took a few pictures for Ansel, especially the one with the virus picture. So, and I did not get bingo.
Oh, you didn't?
No,
okay.
but
there was a secret bingo game going on. Okay, just to say.
But I wanted to ask about kind of in a comparative perspective. So, we've talked about like in Switzerland and maybe even here a little bit in Germany, there is also skepticism about vaccines and like health, intrusion by the healthcare industry, et cetera. But it doesn't feel, or it seems like that kind of animosity and vitriol is not the same as it is in the US, or it seems different. So I'm just wondering if there are kind of lessons learned across kind of more of a comparative space between European countries and the US since you've been here. Like, what have you learned?
Yeah, I mean, and we have some experts here who could probably make comments, but I think it's really important to avoid overgeneralization. In the US, it's a lot of different groups and individuals, came to their views in different ways. And so that idea of meeting people where they are is really earnest, that, people may have had a bad experience with a medical provider, or they may have a religious tradition that doesn't have a problem with vaccines, but they don't have a tradition of getting vaccinated until they see the imminent threat. But I think in Switzerland and Germany, there's some very, very old kind of anthroposophic traditions that avoid medical interventions, and that it, perhaps because it's longer term, hasn't necessarily been as explosive as what we saw in the US during the pandemic. But I think people here could say, yeah, it was explosive. You just didn't read about it because you were too busy dealing with the US. So I think we really need to individualize the assessment. And there are a lot of, good behavioral science and anthropologists and so forth trying to understand the cultural context by which some things emerge. You may have heard of the Somali community in Minnesota, whole set of things going on there that's pretty different than what was happening in Texas or that what's happening in Florida. And I think what we focused on back when I was director of our immunization center was really the movable middle, or the majority of people, trying to retain vaccination being a social norm, because it was a social norm and it still is a social norm. And that's perhaps why some of the politicians are walking away from it. But even when it was a social norm, like a big time social norm, everybody thought they were the only ones vaccinating. They thought no one else is, but I can't even talk about it because the media was really focusing on the extreme cases. Oliver?
Yeah, thank you so much, Anne. You painted a fascinating historical picture of what's happening in the United States, but I also happen to know that you've worked internationally for a large part of your career and continue to do so, working with Gavi and other groups. How do you, see this in a kind of global context? What are the implications from the change of position within the United States towards vaccines in terms of global vaccine policy, global vaccine uptake, financing for vaccines around the world, and other maybe downstream consequences that we might anticipate?
Yeah, the consequences are enormous. So, the U.S. government provided 13% of the funding to Gavi, the vaccine alliance that, has saved, a zillion people. And so that's a hit that the global vaccine effort has taken at a time when, European donors who are very supportive of vaccines have had to increase the defense budgets and tighten other streams. It isn't just the funding, but the leadership and the confusion. So I've heard from colleagues working in many different countries about, the rumors in the US filtering to, a doctor's office in Pakistan, or to mothers presenting for care somewhere else. In a lot of the poorest countries, access is a bigger deal. And, people who are unreached by everything is the main thing. But the rumors can affect almost anyone, and the information can move everywhere right now. So it's a big concern. And, I would say, you were probably there. Like, there was a World Health Organization meeting about, 10 years ago, where the Americans and the Europeans were talking about vaccine hesitancy. And, there was a non-governmental organization who's like, we need like delivery, not, that's not an issue, but it's becoming an issue. So I think the harm that's being done right now is way beyond dollars. And it's a voice that is dangerous. And hopefully the walking back that we're seeing right now will be a permanent walking back. There's a pendulum with immunization, with a lot of public health. Money goes up, disease goes down, money goes away, the disease comes back. But this attitude stuff is really difficult, and the information environment, is way bigger than vaccines in terms of the damage right now. Adam, we have, and then in the back there. Okay.
Thanks very much, Anne. I wonder if you could talk a little bit on the COVID response, about the impact of the geopolitical competition, because the president called it the China flu, and then we had the very politicized debate about, was it a lab leak or and China's responsibility, and then clearly China was using its response to attract soft power, and so how did that, you think, shape the response, and how people in the States responded?
Yeah, I think Americans really think about Americans and don't think that much about the rest of the world. But there was so much going on. I think that pandemics, by virtue of being everywhere, really are challenging. And so even where there was global solidarity, this thing called COVAX, which was developing vaccines for the world and had commitments to get, they really did a great job of getting billions of vaccines for low-income countries. But they were really relying on a supplier in India who was making vaccines, and then India had a big surge in disease, and the nationalism was like, you can't send this vaccine to Africa. We need it here at home. So I would say every country was putting their own interest first, and the multilaterals that were working hard to make sure there was vaccine for the global South, had some challenges. One of the aftermaths, though, is this thing called the African Vaccine Manufacturing Accelerator, which Gavi is helping to support, which provides some milestone incentive funding to industries that hit hit certain targets for Africa-produced vaccines. The continent of Africa got a lot of solidarity during the pandemic, saying, we can't expect anything from the rest of the world. We need to do it ourselves. We can handle this. Let's get together. So there was a lot of political movement behind that. And then I think the other thing about America was, of course, we had an election in the middle of the pandemic, and we had a new party. And so everything that one administration did was wrong, and everything that the next administration did was wrong for the next administration. So the political issues in the states became a big deal, and the China flu. I mean, it just. Yeah, so I would say the issue with, was it a lab leak or was it a natural event? Both have to be dealt with. Both are possible, but we may never know. China is a pretty complicated place. I think a lot of you guys are experts. But from what I could see, the focus of the leadership in both administrations that I worked for during the pandemic was, like America first, not America first, but we have to take care of our country. We want to help the rest of the world, but we have to save lives here. In the back there, yeah.
Doctor, I would like to share my experience. I'm from Brazil, and I lived in Utah for 6 years as a fellow. And we came from 2019 to 2022 with 39,000 cases of measles.
Yeah.
Vaccines are not mandatory.
Yeah.
We have to talk with parents. We have to talk with mothers. We have to go to the school and convince them to get the vaccines. We came from this scenario to last year, 55 cases, and this year, 2 cases, and they are important from Disneyland. So access, we have to go in a box with ice, with vaccines through the Amazon River. So we have difficulties for some areas of the country. Of course, we don't have insurances because everybody can get the vaccines, but there are hope. And the hope is not making vaccines mandatory. We have to, day by day, we as a physician, I'm saying, and we are all here as community, we have to talk to people and we have to convince them. When you said vaccines were a social norm, it was. We didn't have an excuse to not get vaccinated. And now we have many arguments that we have to discuss with community to get them back to our club. And schools are a great place to make them a funny day, a day with a party, balloons, and vaccines like we had in the past, because we're not going to get to the point that we were making vaccines mandatory again.
Yeah, thanks. The story of mandates is so complex and very interesting, and I really appreciate the Brazil experience. And it was fantastic that Brazil got control again after the very challenging epidemic. The mandates, or the school requirements in the United States, are determined state by state, sometimes city by city. And they were not really originally intended to force anybody to get vaccinated, but the nature of our healthcare system, where everything isn't, covered, was that people didn't know. The idea of the school was, this is a time in the child's life where we can check. Have they gotten everything? Oh, no, they haven't gotten everything. Well, let's make sure that they have. And so I would say district by district, state by state, over the decades back in the 60s and 70s, there became some requirements because that was a way to make sure that it happened. But it's really interesting. Here in Germany, I learned they didn't have a school requirement for measles until 2020. And that was, I guess some of you have told me, was pretty challenging in the middle of everything else that was happening in 2020. So I think this is where the local culture and the local epidemiology and the local risk really needs to be considered. The thing about measles, it's really contagious. And as you can see in your country, you went from 0 to 35,000, and we went from like nothing to now it's 1,700, but it could easily be 50,000 next year because the numbers that exempted over the years have really grown. But it's really, it's very fitting for the academy because it's really the individual versus the community. and what do we do? And one of the challenges with vaccines is there's not really a harm of these vaccines, but there's a perceived harm for some people. And that group has really, spilled over to a lot of others. Yeah. Matt. Mm-hmm.
Thanks so much. It was a great overview. I was just wondering, something that you mentioned that resonates with my experience is that anti-vaccination sentiment has become part of an identity which has other elements in the United States. So things like belief that there's widespread election fraud or something are together with it. And that it strikes me that would make your job harder, because you're not just fighting misinformation about vaccines, you're also fighting arguments about other issues when you're, if things are tied together in that way. I was wondering, is there work on how things get disaggregated from identity, or do you have thoughts about how one addresses that kind of thing?
Yeah, it's really difficult right now. The CDC used to enjoy this incredible privilege of, we weren't located in Washington, we were in Atlanta, we were a science-based organization, and a lot of people didn't even know we were part of the government. So we were sort of, okay, we didn't have that view of being politicized, but we do now. We had one person who was a political appointee as the director. Everybody else was career staff. And it's really hard right now because the politics is really, the ideology is leading rather than the science. Obviously ideology is important, or values are important, but the science is the science, and then the policymakers can, do what they want with it. I think that I don't have all the answers. Let me just say that. My mantra is humility. Okay, so I try to understand, but I think that one of the most important things we need to do is at the local level, because I think it's very easy to demonize or compartmentalize what's far away. If it's the politicians in Washington or the people at the headquarters at CDC, but that the local voices, whether it's the doctor, the nurse, the moms, can be important voices. A colleague has shared with me that health officers at the local level are being trained about how to become influencers, how to get on a podcast, or how to get to be talking as a regular person from the community about, what you're doing with your family and what you know and what you don't know, and, how to try to build that trust up locally. And I think that's going to be very important. It's hard to scale, meeting everybody where they are, but I think the closer you are to the community, whether you're from it or live in it, it's a stronger position point. But I think you're right that it's not just vaccines, it's not just health. There's so many issues that have gotten rolled together. But I am encouraged that this past few months we've seen this walking back of what really is extreme and is not helping. It's not a majority popular view. They realize that now from the polling. And there was even a poll, I think, yesterday about, trust and doctors and scientists are actually still trusted a lot more than congressmen and politicians, and actually more than the media. Sorry for some of you. But I think the local levels is important. And then besides that, I think coalitions, the groups of states, the groups of organizations working together towards a common purpose. And really, I said humility at the beginning, but I think it's important. We have to keep learning. And not everything that was done in the pandemic in the US or anywhere else was perfect. And we need to admit the mistakes and go from there. So.
Thank you very much for taking my question, ma'am. I'm a former soldier. You were a rear admiral. And as someone who got a lot of vaccines during their time, thank you for all that you do. Never got anthrax once. I think my question goes into a little bit of the previous one. In a world where we can have a discussion in a room of 80 people, and in the meantime, 12 people can have 20 TikToks going out to millions of people, what does communication moving forward look like for these organizations? How do we talk properly?
Yeah, I think one of the slides that I cut was an attempt to step back from the tactics to the strategy to look more holistically. And I might even still have it. I don't know if I have it here. No, I don't have it. But there's a group. In fact, I guess I had the reference in there. The tiny reference that you can't read is a public health framework for information, and it's not debunking and fact checking, but it starts with primary prevention or primordial prevention, and then primary prevention, secondary prevention, so forth. It's kind of jargon, but we need to help people be resilient. We need science literacy. We need to address this systemically, not note by note or information piece by information. One of the things that my reading suggested was, it's not so much the misinformation that we should focus on, it's the information, and making the information clear, simple, catchy will help, because the misinformation is a tiny, tiny piece. And as health experts, we didn't really come up being the greatest communicators. And so working on that translation is very important. Sadly, one of the first things that was cut at the CDC was the communication apparatus. So, hopefully this is just a blip, but it's a pretty dangerous blip. Dan? Yeah. Dan gets prerogative, right?
On that point, I mean, we all saw the statistics in the course of the pandemic about much higher mortality rates in very red states where there was great mistrust of the government and where a lot of people weren't getting vaccinated. And I'm just curious if there's any evidence of learning in those environments, of absorption of what happened, or are they simply not in a comparative state of mind, and it happened and that was that, and move on and retain your low trust approach to life?
Yeah, I mean, I think that the attitudes are really different than knowledge. And I think we got to this place where self-interest wasn't really working, but pride and identity and dignity were really connected with complex factors. And so, and we really have to acknowledge that, dying from COVID was not necessarily the only thing going on in people's lives. There were a lot of people who felt disenfranchised from their job, had all kinds of things going on. And so I try to remember as a health person that it's not the only thing people are thinking about. The other thing is we're on this wave of anti-elite, anti-science, and sort of the teaching people is not probably the answer to rebuild trust. There's some other ways we probably need to start rebuilding. But, I think it's just tragic. We lost people who we didn't need to lose. What could we do differently in the future so that there is more trust? It's been interesting to be here when there's some really interesting modeling that people have done, doing comparisons of countries and how they did during COVID. And one of the things that apparently helped your health outcomes was greater trust in the government versus the people around you. But the places with the greater trust about the people around them and not the government, a lot of it Eastern Europe, were had a lot of deaths because you were used to people being trustworthy and the government being corrupt. So it's really complicated. But I think that issue of, I don't think teaching is going to help. I think rebuilding through local communities, local messengers who are from the community, who understand the dynamic, who start to have those conversations. And a lot of America needs that right now. So depressing. Let's have a happy question, right? Mm-hmm.
So thank you very much for a wonderful lecture. I have a question that I've been thinking about for a long time that I don't have an answer to, and I'm sure you've thought about too. So why vaccines? Because I can understand that people are opposed to things that might decrease their degree of liberty, such as you can't, go to the movies, you have to wear a mask, things like that. Or because of climate change, you should, decrease your, mobility or something like that. But vaccines actually increase your degree of liberty. Mm-hmm. And especially during the pandemic, that was the moment when people could go back to, schoolwork and so on. So I do understand that it's easy to frame an intervention like a vaccine as something dangerous, but why has this been going on for centuries essentially, and why is it vaccines when this is a single shot that basically protects you from a deadly disease or gives you all this degree of liberty? So why is this so popular, and why does this sort of marry with identity and all these other misbeliefs? I don't understand. There's no, it could be aspirin, it could be, I don't know, useless vitamin supplements that people promote. Why is it vaccine, something that is so proven to be so safe and effective?
Yeah, I mean, I think there's probably lots of things that are different about vaccines, but it has been going on for centuries, probably hundreds of centuries, but or hundreds of years. But one of the things that's unique about vaccines in the medical world is you give them to healthy people to prevent something bad from happening. And psychologically, we think really differently about not wanting something bad to happen versus giving me something to make me better because something bad already happened. So, there's a much lower bar for drugs to be approved for treatment than there is for vaccines to be approved for use for prevention, a really high bar for industry to show safety because we're giving them to healthy people. And you have a very low tolerance for anything bad. I mean, a little, very, very rare problem has to be weighed against this is a totally okay person, and what are the risks that they're gonna get the condition. In the 60s, it was a lot easier because everybody got measles. It was like everywhere, and it wasn't always serious, but it could be serious. And when it was everywhere, the serious cases were visible. Now that vaccines have worked so well, people haven't seen the diseases and have very low tolerance for any kind of side effect. And then because there are a lot of vaccines and bad things happen, there's this temporal relationship that people have linked onto that, I had a baby at 6 months and he was doing fine. And then at 8 months, it didn't seem so. And, things that present in the first couple of years of life could easily be linked with other exposures that were happening, including vaccines. So yeah, I don't know. I mean, basically, I don't know. But I do think the idea that we're offering them to people who feel fine or whose children feel fine, and anything that happens afterwards might be psychologically linked rather than necessarily causally linked.
Thank you very much, and that was wonderful.
Thank you.
There have been a number of lawyers who've been disbarred for behaving in unprofessional ways. And there have been some politicians who are trained as doctors who have been in support of the anti-vax appointments. Have there been any consequences for that?
It's such a confusing time right now. One thing I would say though is it's just a specific anecdote, but the first individual who was considered for the CDC directorship, this administration, was a former congressman and physician who had been very vocal in hearings about the safety of vaccines back, 25 years ago. And his peers in Congress did not feel like he was okay. So he did not, he withdrew his nomination the day of his proposed hearing. So I would say, a consequence was that was too far out. You could say that about our secretary. How did the secretary get confirmed? How is the secretary still there? Politics is way higher than my grade as a 2-star admiral. So, yeah, perhaps over the beverages in the next section of the evening. Yeah. I think we have announcements or, okay. Okay. So thank you all so much. It was fun.